Hey guys, thank you for joining us today. This is Julie, my patient. I've been treating her for several years. She is getting ready for a big birthday coming up. And so she's just wanting a little glow up. So we're gonna do some Dysport to her upper face, and we're gonna do some Botox of her lower face to kind of give her that glow up right before her big day. We typically do in between the brow, the forehead, and around the eyes. And also now she's wanting to add Botox here to her masseter area for her clenching and grinding that she feels like she constantly does and just feels like a lot of tension. So we're gonna really relax this muscle, because I always like to tell patients it is very common because a lot of people carry a lot of tension here in the jaw and down to the neck area. But what a lot of people don't know, it is the strongest muscle in the face, and by weight, it is the strongest muscle in the body. So it can very much get hypertrophic over time. So it does take quite a bit of units to put that muscle down to kind of really relax that muscle. So whereas I might be doing, 50 or 60 units all over the upper face, I'm going to be doing 20 and 20, so 40 units just alone on the lower face to actually put that muscle down to make it relaxed. So when I'm doing Botox on patients, especially even if it's new existing, I always take things in consideration and see if there's any changes. Always ask their medical history. Has anything changed since you were here last? Weight gain, weight loss, anything like that, anything significant going on in their medical history that might be presenting themselves in a different way or a different light that they're noticing from even the past 3 or 4 months that they've been here. And also what I like to do, and not to be critical, but I do like to point out some asymmetries just because they're there and they've been there, but also that they might continue to be there after we've done our treatment, and sometimes we can tweak a little things to try to even things out a little bit, but that's why I always like to show the patient, especially looking at yourself in 3D and seeing yourself in a screen versus if you're just looking at yourself in a mirror, you're seeing yourself in 2 dimensions, so it looks completely different. So if I'm just looking at this area, I can see this brow's a little bit higher where you arch a little bit more, and you're stronger here on this side of the forehead. So things like that, I just take in consideration to ask the patient if you want this a little more relaxed, or hey, I like this arch brow, I like more openness, I want to try to achieve this one and open this up a little bit more.
I do like the arch brow.
Okay, so we will soften it a little bit, but you're still going to have the availability to raise the brow, because if I put toxin here, it's going to relax it to some degree, right? I know, and two, these are very superficial lines, so what I'll do is I'll put a little toxin here in the superficial line, here in the superficial part of the skin versus actually treating the muscle, because if I'm putting Botox in the muscle here, it's not going to give you the availability to raise your brow. Right? Because a lot of people think is if you're making this go to sleep, this is going to become overactive. And some people want to become overactive and give them the availability to raise that muscle to begin overactive. Because what we're doing is relaxing a muscle because we want the other muscle to be counteractive and overcompensate. We only do what your body's going to allow us to do, right? If something's asleep, then this is going to become overactive. We're going to put some Botox here underneath the brow and then right above the brow a little bit to give you a little more arch on this side as opposed to this side right here. Okay?
Wow, my eye looks completely different than it does over here.
Mm-hmm. Yeah, the shape looks a little more different because you have a little bit of excess skin, more so on this side than this side, because you can see about 1 millimeter here from here to here, the lash line, and there's not as much over here. So what we don't want to do is to hood you, make you feel heavy, right? So we have to be very cautious of what we do on this side, because we want this area to raise and give you a little bit of a lift on that side. Right down for me. Relax. Okay. Do you get tension headaches? Do you get them up here? Okay. So a lot of times I will do, when I'm doing the Botox to the masseters, this muscle is attached to the temple muscle, right? They're attached to an interfascial layer. So when you bite down and you clench, you'll also clench here in the temporalis muscle. So if this one, I don't want this one to become overactive if this one is relaxed a little bit. So if some people do have tension headaches, I will go ahead and treat here, right here in the temporalis muscle, again, to relax that as well. So when we are doing Botox to the masseters, I always take in consideration all parts of the face, but especially this area right here. Yours is pretty good. You don't have a significant amount of jowling, but if patients do have a significant jowling, it's going to make this worse, because this is going to slim and this will appear a little bit worse. It's not that it's adding to it, it's just decreasing, and you're losing the structure of the jawline here, making this appear a little more full like that. Because right now, the masseters are supporting the jawline, right? So I always caution patients when we get, as we get a little bit older, a little more wiser, we will start kind of losing that support there. So I always caution you that I usually only do about half the dose, just to see how your body's going to react to it, because you're going to start slimming at about 2 weeks, and then you'll continue to slim for about 6 weeks in that area. So that way we can watch the change. So although you get the therapeutic, relaxation of it and the therapeutic effects of it, you're also going to get the aesthetic parts of it, whether you want it or not, which is the slimming of this part of the face, which is great for somebody who has, a nice full face, and we want to slim that in aesthetically. It's great, but we have to take in consideration as we get a little bit older, the sequela effect of that.
And you may see these lines a little more.
Mm-hmm. Might be a little bit filler if we have any volume loss here, and usually I do this by doing a little pinch test here, and you don't have a significant amount of volume here. But just a caution, there's just a little bit here, but since we haven't treated the masseters for you before, we're going to start with a lower dose, and then we're going to reevaluate in about a month and to see what that looks like, and then also check how strong they are. Okay? Okay. Bite down for me. There's a deep and then there's a superficial layer to the masseter. I'm going to try to get rid of the little bitty superficials here. And I'm going to relax this because this one's overactive here. Raise your brow. I'm just going to keep you high because I still want you to have some movement for here. Because you like the arch, right? Okay, squeeze tight. Closed. And squeeze tight. There you go. Okay, I'm just checking the skin because that tells me I don't want to go too far around with your toxin to where you relax this. I'm just do this just superficially right through here. Just little bitty blabs. Smile. Yeah, just to soften this area right here because I don't want to go too far around. Around for me, darling. Yeah, I like to treat these little hooks right here. I call the JL hooks. Raise. Yeah, you don't have a lot of movement here. So raise your brow. Do you see you don't have hardly any movement here? Mm-hmm. So I wouldn't want to waste toxin here by putting it here because you really don't have anything right here. It's just way at the top of the light. The frontalis where it kind of goes like this. So, and then you want to treat on either side because this.
Yeah, that's exactly
right.
Where your movement is.
Where your movement is on basically on either sides of it. The frontalis is one of the hardest areas to treat because there's always a dance, right? It's like, I don't want to see the lines, but I still want to have movement, right? If you're moving, you typically kind of see the lines. I'm just going to keep you a little bit higher here just because I want you to feel like you open it up as much. You will open up quite a bit too because I always say this is kind of my safety net is when you're doing the orbicularis oculi around the eye because this is one of the few muscles that has two functions because when you close down here and then it raises up the cheek. So smile. So yeah, when we smile, so the brow goes down and the cheek comes up. So it's two opposing areas. So when you tox it on down here, this is going to relax. And when you tox this is going to open up, right? Because the toxin is going to do the opposite effect of it. So it's like a sphincter because we have 3 in our body and 2 are in our face. So you want to open it up like that. Okay. Okay, lay back. I usually like have patients closing their eyes so that way they're not seeing needles stuck at their face. Do a little superficial injections. Tiny baby aliquots. I did these superficial ones here because I want to give you more lift here I didn't do this here because then we would have the same thing, right? We'd have still more of an arch over here than we have over here. So we want to give this one more of an arch than this one over here. So I didn't go as high on this one. I started a little bit lower, if that makes sense. Okay. Right there. Okay, brown for me. These are little superficial injections here in the lateral portion of the corrugator. So when people come in and they have like constant like clenching and grinding, I always ask if they've ever been diagnosed with actual TMJ from a dentist, because we just want to be cautious of that too, so we don't over time just kind of weaken the joints. There are 2 layers, a deep and a superficial layer to the masseter area. So when you do treat masseters, you do want to make sure you treat both of those areas. So for the constant clenching and grinding, this muscle is here, the strongest muscle in the face, and by weight it's the strongest muscle in the body. So it takes a lot to kind of put that muscle to sleep and kind of put it down. So people do it for a therapeutic benefit. The therapeutic benefits are, hey, I need to relax this. I'm constantly grinding or just clenching all the time, and I don't even realize I'm doing, and I wake up and I'm just really, really sore. And then sometimes they get headaches from that as well. So when you do Botox there, it's going to relax that, so it's under less tension all the time. You're still able to chew and all that and have the mastication and movement of those muscles and everything. It won't affect that at all. The aesthetic part of it, you will have slimming of the lower face. So whether you like it or not, you're still going to slim. Okay, so which kind of be good and bad. It's great if you want to have a slimmer look to the face. If we have, more of a round face and we want to slim, then people do it just for the cosmetic portion. But if you do have the therapeutic need for it, you're also going to get the aesthetic because we're just relaxing that muscle and debulking it. So you're going to have slimming of that muscle, and it's going to slim the lower face. So we just caution that also with patients younger, not as much unless they already have a little bit of gelling and have a propensity to that. It can feel as though it's worse because this muscle does support the jawline and support the skin. So we always just proceed with caution and make sure that we're treating the appropriate patient, the right candidate, and the right dose. There's 2 kind of markers that I use because there is a muscle here that's superficial. It's called the rasorius that lays right over the masseter. So when patients smile, okay, you can kind of see where these little marks are here where they start to smile. So it lays right about here. If not, you can just draw a line from the corner of the mouth here. And so I want to say deep and below that area. So I usually feel the anterior, the front portion of the masseter here, and I can feel hers without hers even clenching down, like where it's going to start. So this is the front. So I don't want to go past this area. And then bite down for me. Okay, relax. And you can see hers is already budged. And I marked kind of where she bulges most. So I'm just going on either side of that. Now we're going to treat the lower face. So we have the platysmal bands, and then they kind of come down, and then they kind of gently wrap around the jawline here. And so the muscles themselves don't lift. They actually pull down. They're depressor muscles. So when we do this, make this face, you can see this banding right here. So when we treat Botox with the bands, it's not going to pull down as more to feel like it's creating a lifting effect, if that makes sense. Because the muscle, we're not allowing the muscle to pull down anymore. Can you do that again? Right down. There we go. Right down again. There we go. Okay. And nice for you, you don't have it over here at all. If you guys see this, you can look straight ahead and bite down. You pull here, you pull on this side that's stronger, and you don't have any pull over here. So there's no need to treat this side.
Oh, wow, yeah.
Okay, leave it for me. Okay, try this way for me. Okay, right down. I am injecting her temporalis muscle. So the temporalis muscle is connected with an interfascial layer of the masseter muscle. So when you clench, you will bulge here in the temporalis muscle as well as the masseter muscle. So I will put a little bit in the temporalis muscle when I am treating the masseter muscle. Dose is going to depend on how, super bulgy they are. If somebody has quite a bit of a curve here and they bulge quite a bit here, then I'm going to put a little bit more here, because you can put up to about 20 units in here, depending on the patient and the amount and the strength of the muscle. Okay. No bleeding, no bruising. Yay! Okay, so aftercare after Botox is no working out for 24 hours. And don't wear a baseball hat or visor on your forehead for 24 hours. Okay, don't go get a facial or massage for, I'd say, at least closer to like 2 weeks if you're having a hydrofacial or a diamond glow. And then between 2 to 3 weeks is when you're going to have your full effect. This is going to start kicking in about 3 days. You'll start seeing some softening and weakening of the muscle, but full correction is going to be like between 2 to 3 weeks. So, and don't be surprised if one area feels like it kicks in a little bit faster. That's completely normal. Okay. So each pharmaceutical company has FDA indications for each of their toxins, and just because it is FDA approved and indicated for a specific area and a certain amount, it doesn't mean that that patient specifically needs that amount. It's just like everybody's face is different, everybody's treatment's completely different, as well as how much they need of something. So for you, for your Dysport, we used 40 here in the glabella area, 40 in the frontalis, and we use 20 and 20, so 40 around for the crow's feet. So your Botox, I typically do 20 and 20, which is a total of 40, but for the reasons kind of we described, as far as to make sure we don't have too much slimming in this area here, when we debulk the masseter muscle, we did 12 and 12. So I did 24 total on the lower face. So we will reevaluate in about 3 weeks to see if we need to add a little bit more, depending on how everything's looking. On average, people get Botox, it'll last approximately 3 to 4 months. So it's not gonna full on effect for 3 to 4 months. And what I mean by that, the way I explain it to patients, it's a slow onset, right? So we inject you, you're not gonna notice anything for about 72 hours, and then it'll start weakening. And then your full effect is going to be between that 2 to 3 weeks, okay? And then you reach your peak at that level where it's fully kicked in, and that's what you're going to wear for about 8 weeks. That's not going to last you for 12 to 14 weeks. You're going to wear it for about 8-9 weeks, and then it's a slow trend down, right? So just like the bell curve, you'll go up and then it'll kind of just relax down. So you'll start seeing some softening and weakening, just like you did at the very beginning, softening and weakening when it started to kick in. You're going to notice that on the tail end as it trends down. Okay, so average is about 3 to 4 months is when you continue to come in to get treatments. So we are 3 weeks out from our Dysport treatment for upper and lower face. So we get to see the results and to see if we need to do a dose adjustment, because especially on the areas that I do a little more conservatively on patients, as we get more so mature, we'll say, we start losing fat volume. All right. So what happens is the frontalis, this muscle, our elevator, starts overcompensating. So when we lose volume and we have a little more shift and a little more laxity, we will have to be very careful about treating this area of the upper forehead, because it's losing the support of that fat pad underneath, and so the muscle wants to kind of take over and become overactive. But then again, we have to take in consideration brow position, any little excess skin too, because we don't want it to do this, right? It's because we have to take consideration. So anytime I'm doing Botox or Dysport to the lateral frontalis, I always kind of do there to see how much room I have, if it's really loose or if it's tight. So yours is a little bit looser over here than it is over here. You're a little bit tighter over there on that side. Let's frown for me. Okay, you can't really hardly frown. Okay, raise your brow. Okay, we do have some movement here, so we're gonna touch this up here in these two areas, and then we're gonna go superficial. These little, what I call little rainbows, are a little bit tough to treat, because if you treat too deep, you're going to be in the frontalis muscle and you're going to drop. So the only way to really treat these little guys are just really superficial injections, fine lines under them. So when we go superficial, it won't last as long because I'm not going into the muscle. So that treatment's only going to last about 4 to 6 weeks just to soften it. But we can soften these a little bit. So I say they won't completely go away, but things that will help are like a retinol and doing lasers, because that's going to help thicken that epidermis and that dermal layer, because it strengthens the skin and stimulates collagen and elastin. That's why the aging process is multifaceted. So we do our medical grade skincare at home. That's what you're doing on your end. And then you're doing your aesthetic treatments for the collagen and elastin stimulation. And then your preventative are your Botox. Again, because the muscle's still moving. So when we do Botox or Dysport, it's going to relax the muscle. When the muscle relaxes, the skin relaxes and it gets a break, because it's been under constant tension since we were infants, right? So the muscle movement hasn't changed. Our skin's changed because we've aged. It's one of those things you have to continue to do, because it's not a one-time fix-all, because we're still aging, right? So you have to continue on a maintenance plan. So, and then I'm going to do this band. Okay, so we did have some improvement on this platysmal band, but he's pretty strong, so we're going to touch him up here. Do that again for me, Julie. Yeah, we're going to hit this one right here to soften this. Okay, when I like to treat these, I like to go at an angle. Okay, now I'm going to go very superficial with these little guys right here. Lean back for me, darling. Okay, raise your brow. Okay, relax. You're so fine, it's crazy. Okay. We're gonna hook like right here. And she actually goes all the way to her hairline. It's really good. On this side. Okay, raise your brow, darling. Yeah, so these will soften a little bit, and then I did a little bit. See how those are superficial blebs? Mm-hmm. So I usually do those too when I'm doing, like, people have like the radial cheek lines that go all the way out here. Then you can do superficial blebs in the skin, which is good because it takes care of the skin, but not so deep that it affects the muscle and then the cheeks drop. Botox or Dysport, a neuromodulator, lasts approximately 3 to 4 months. So for your maintenance, to keep that muscle relaxed and therefore the skin relaxes and gets a break, your treatment is going to be 3 to 4 times a year. We talked about aesthetic treatments, lasers, microneedling. Lasers, you might only need to do that 1 time a year or 1 time every other year. But you want to do that really in the fall and the winter months when you're not in the sun. Microneedling, I love microneedling. It's a superficial way to stimulate collagen and elastin, and most people do that 3 to 4 times a year. The nice thing about microneedling, it's minimal downtime, maybe 24 hours where your skin's a little pink, but you don't necessarily have to worry about being out of the sun, and pick a certain time of the year to do microneedling to stimulate some collagen and elastin. And medical grade sunscreen and medical grade skincare is every day. You do it at home. That's how you maintain the beautiful results with all these treatments. If you've been considering any of these treatments, whether it be lasers, microneedling, Sculptra, injectables, Botox or Dysport, just reach out to us and we're happy to answer any questions we have for you and put together a customizable treatment plan that fits you and your needs.